Is Mpox the brand new devil in our lives? Like COVID-19, will it once again severely disrupt normalcy? We need to know, here and now. What is Mpox? Is Mpox similar to COVID or smallpox? How big is the danger? How imminent is the danger? How prepared is India and different governments? How prepared are global organizations? What is the vaccine scenario? What are the possible scenarios?
Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice.
According to WHO, the monkeypox virus is an orthopoxvirus with symptoms similar to smallpox, although less severe. Two distinct clades of the monkeypox virus have been identified. Clade I, previously known as the Congo Basin Central African clade, and Clade II, the former West African clade. Mpox is a zoonosis, a disease that is transmitted from animals to humans. According to WHO, patients with monkeypox show symptoms that are comparable to those of smallpox. Both infections have an incubation period of up to 17 days. The person could subsequently feel uncomfortable all over, have a fever, and have a headache. Hard lesions that eventually fall off the body and grow over time. Monkeypox, unlike smallpox, usually does not result in death. Mpox and COVID-19 are both zoonotic diseases transmitted from animals to humans. SARS-CoV-2 is a respiratory virus. It spreads through virus-laden droplets released during breathing that can be suspended in the air for minutes to hours. Moreover, people can spread COVID-19 even if they are asymptomatic. According to the CDC, which is the Center for Disease Control and Prevention, United States, people who have close contact with someone who has Mpox are at risk of infection. Close contact includes skin to skin, such as touching or sex, mouth to mouth or mouth to skin contact, such as kissing, and can also include being face to face with someone who has Mpox, such as talking or breathing close to one another, which can generate infectious respiratory particles. People who have sex with multiple or new partners are most at risk. Someone who comes into physical contact with an animal which carries the virus, such as some species of monkeys or a terrestrial rodent, such as a tree squirrel, may also develop Mpox. Over 120 countries have reported the Mpox between January 2022 to August 2024. Of these, 100,000 of them are laboratory confirmed cases. Over 220 deaths have also been confirmed. According to available WHO data, between 0.1% and 10% of people with Mpox have died. It is important to note that death rates in different settings may differ due to several factors, such as access to healthcare and underlying immunosuppression, including because of undiagnosed HIV or advanced HIV disease. Professor Dimi Ogaina, chair of the IHR, the International Health Regulations Emergency Committee, emphasized the upsurge of Mpox in parts of Africa, along with the spread of a new sexually transmissible strain of the virus, in an emergency not only for Africa but for the entire globe. India's first and so far only Mpox patient, diagnosed with the disease in September 2024, is currently isolated at a special facility in New Delhi. The Union Health Ministry in India is set to issue advisories to major entry points such as airports and seaports, instructing them to stay vigilant and manage suspected cases effectively. In the southern Indian state of Tamil Nadu, the Directorate of Public Health and Preventive Medicine, the DPH, has already heightened alert levels. Both Hyderabad and New Delhi, cities that are popular among African students pursuing higher education, have also been placed on heightened alert. Bengaluru Airport is on high alert, including tests and a 21-day quarantine for flyers with suspected symptoms. UK Health Chief says that they are making plans in case a new type of Mpox virus is detected in the country, but they emphasize the risk is low. Senior Biden administration officials said recently that the United States is preparing for the possible arrival of a more severe version of Mpox. Indonesia recently introduced a health pass, mandating all international travelers, including aircrew, to complete an electronic self-declaration health form before entering the country. France's Prime Minister Gabriel Attal said his country was on the highest alert and would implement new recommendations for travelers to risk areas. WHO also launched a global strategic preparedness and response plan to stop outbreaks of human-to-human transmission of Mpox through coordinated global, regional, and national efforts. The plan covers the 6-month period of 2024 to February 2025, envisioning a US $135 million funding need for the response mechanism. According to the Yale Medicine, 2 vaccines licensed by the Food and Drug Administration, the FDA, are available for preventing Mpox. Jynneos is a 2-dose vaccine separated by 4 weeks, which is up to 85% effective in preventing Mpox after 2 doses and is recommended for those who are at increased risk of exposure to Mpox and those who have been exposed to Mpox in the past 2 weeks. The other vaccine, called the ACAM 2000, is a modern iteration of an old smallpox vaccine. The WHO celebrated the eradication of smallpox in humans in 1980. This vaccine has been used for Mpox, but can lead to serious illness in people with compromised immune systems. Experts are divided about the possible scenarios in Mpox. According to a report by Johns Hopkins University, June 2024, clustered outbreaks of Mpox Clade IIb remain a concern in the US and elsewhere, especially as summer festivals, celebrations, and other events that bring people together from around the world occur. According to Dr. Marwan Azhar, a Yale Medicine infectious disease specialist, I believe our encroachment on the natural world has brought us into closer contact with animal species we had never been closer to before. That has facilitated the transfer of viruses that mostly circulate in animal species. And since humans have not been exposed to them, there is very little pre-existing immunity to these viruses, which make us more susceptible. Europe's Center for Disease Prevention and Control said that more imported cases of Mpox from Africa were highly likely, but the chances of local outbreaks in Europe were very low. Mpox spreads very slowly, unlike coronavirus. Shortly after coronavirus were identified in China, cases jumped exponentially from several hundred to several 100,000. It's taken since 2022 for Mpox cases to hit nearly 100,000 infections globally, with about 200 deaths according to WHO. Also, there are vaccines and treatments available for Mpox, unlike in the early days of COVID-19 pandemic. We have what we need to stop Mpox, said Dr. Chris Bayer, director of Duke's University's Global Health Institute. This is not the same situation we faced during COVID, where there was no vaccine and no antivirals. Abrar Karan, MD, postdoctoral scholar of infectious diseases at Stanford Medicine, has a note of caution. With the new Clade Ib Mpox outbreak is today, won't be next week. This is quickly and constantly changing situation. So far, it seems that Mpox outbreak can be controlled, but clearly, there is no guarantee. The devil is indeed at the door, and we must all join hands to be totally vigilant. WNO Bureau, Kolkata, India.